Imagine being a university student called to your professor's office to talk about your exam results. When you arrive, he locks the door and tells you that the only way to get your grades is to have sex with him. For many people, this kind of situation is not rare. And university is not the only place where you might be asked for a sexual favor as payment for a public service. A police officer might demand to have sex with you to avoid being arrested. Or a doctor could deny you needed health care unless you paid them with sexual favors. Paying a bribe isn't always about money. Sometimes sex becomes the currency. This is called sexual corruption and is the abuse of entrusted power to demand or obtain sex or sexual favors. It can happen anywhere where there's a power imbalance and to anyone, although not equally. Groups facing unfair barriers, including women and girls who tend to rely more on public services, are often affected the most. Transparency International is working with marginalized people and communities to end this. We provide safe, accessible, and confidential spaces for survivors to report corruption, including through our advocacy legal advice centers, where we help people understand their rights and seek justice. For example, in Rwanda, these efforts have led to convictions for abusers in higher education. And through our research, Transparency International has helped shed light on sexual corruption in Zimbabwe's health sector, where it has been reported that patients associated with sex work may be coerced into sexual favors by healthcare workers to gain access to treatment. But this is just the beginning. To really end this abuse and better protect survivors of sexual corruption, we need to make sure their voices are heard and that they have safe systems for reporting abuse. And we need wider changes in society to challenge toxic gender norms, make sure abusers face consequences under clear, enforceable laws, and dismantle systems that make sexual corruption possible.